My name is Daniel Lewis, and I'm going to be demonstrating how to do a IM injection for a reconstituted medication and using the Z-track method. So first, the 6 rights of medication administration are right patient, right medication, right dose, right route, right time, and right documentation. First thing I'm going to do is perform hand hygiene. Next thing I'm going to do is read the doctor's order in the MAR. So for this order, I'm supposed to be giving Rocephin 1 gram IM every 12 hours for 6 days using the Z-track method for administration. So for the powdered, there's 3 different dosages I can reconstitute for. I'm going to choose the 500 milligram per milliliter, so I will be giving a 2 milliliter injection, and that calls for 5.6 milliliters of diluent. So I'm going to check the vial, make sure there's no cracks, check the expiration date, which this one is good. This is going to be the diluent that I'm using, which is just distilled water. Again, I'm going to check the vial for cracks and the expiration date, which is good. So I'm going to pop the top off both of these, and I'm going to use an alcohol wipe to clean the tops of the vials. Alright, now that I've cleaned those, I have to let those air dry. While that's doing that, I am going to get my needle ready. It says I'm supposed to use a 3 milliliter or 3 cc syringe. To me, that doesn't make sense because I'm going to be using 5.6 milliliters of diluent. So I'm using a 10 cc syringe and a 22 gauge 1.5 inch IM needle on top of that. So I'm going to put the needle on and uncap the needle. Now that these are dry, I'm going to stick the needle into the powdered medication to remove 5.6 milliliters of air, because that's how much diluent I'm going to be adding. Okay. Now I'm going to be putting that air into the diluent bottle. That vial is too full for me to do that, so I'm going to draw as much medication as I can because it's too full for me to add that entire amount. Okay, so I have to get back to the 5.6. It's not going to let me add all of it at once, so I'm just going to add 3 milliliters first. It doesn't want to let me add any of it. Okay, so I'm going to add 2 milliliters first. And draw up some of the medication or some of the diluent. only letting me pull up so much at a time. So, right there I have 2.4 milliliters of diluent. So I'm going to go ahead and add that right now to this, to the powdered medication, which leaves me with, let's see, 5.6 minus 2.4 would be 3.2 milliliters that I need to, 3.2, okay. And go ahead and stick that in, put the air in first, and then go ahead and pull up the remaining portion of the diluent, which I got some air, so inject the air back in, and I need 3.2 for a total of 5.6. Okay, so there is 3.2. And I will add the remaining 3.2 milliliters of diluent to the powdered medication. Okay, now that I've done that, I'm going to recap this needle using the one-hand technique. Do it. Now that I have the 5.6 milliliters of diluent in here, I'm going to roll it in my hand to mix up the medication. Not shaking it, but just slightly flipping it over to get the medication off the top, and then continue mixing. Alright, it's not quite all mixed yet. Continue mixing. Alright, there we go, it's all mixed up. So again, I constituted this to the most concentrated, which is 500 milligrams per milliliter, and I have an order for 1 gram. So I'm going to go ahead and uncap this again, and I'm going to pull up 2 milliliters, because that's how much solution I will be pulling from this vial. Go ahead and insert the needle, and I will inject the air and flip this upside down, and I will go ahead and pull out 2 milliliters of fluid of medication. Alright, there we go. There's 2 milliliters. So at this time, again, I'm going to recap the needle. And normally I would replace this needle, but I'm just going to use the same needle because it's not actually going into a patient. But since I used it to pull up the medication, I would change out the needle at this time before I go to the patient's room. So now I'm going to go, now that I have the order dose into the syringe, I'm going to go to the patient's room. So I would knock on the door, identify myself. So I'm Daniel Lewis. I'm your student nurse today. I'm going to be giving you your injection. It looks like it's going to be 2 milliliters of Rocephin. I would ask the patient to identify themselves with their full name and date of birth. And then when I go into ask if they have any allergies, if the patient is laying down, I would have them sit up, or sorry, no, if they're laying down, I would have them stay on their back because I'm going to be using the vastus lateralis on their thigh, the outside of their thigh, to do this injection. So I would just expose that area of the thigh. To do this, I'm going to be using 1 hand breadth below the greater trochanter and 1 hand breadth above the knee joint, which finds me that muscle right there, and I would go right in the middle. So now that I have identified the patient, I'm going to go ahead and put on clean gloves. So now that the patient is in position for me to do this, I'm going to take an alcohol swab and clean the site on their outer thigh, starting in the center and working my way out in a circular motion, and go ahead and let that dry. So I'm going to be using the Z-track method. Basically what that means is when I do the injection, I'm going to be using my non-dominant hand to pull the skin 1 to 1.5 inches towards the patient's body. This thing does not like to move very much with me, so it's not going to move very much, but I'm going to be verbalizing it. So now that that is completely dry, I'm going to again uncap my needle and use my non-dominant hand to pull the skin 1.5 inches to the side, and I will go in at a 90-degree angle in the site that I cleaned, and go in all the way, and I will slightly aspirate to make sure that I am not in a vein. Now that I know that I'm not in a vein, I will slowly inject the medication over 5 to 10 seconds. Now that the medication's out, I will pull up swiftly and immediately release on that, which will allow the skin to go back and hold the medication in the muscle. I dropped the cap for my needle. At this time, I would put the needle in a sharps container, which I don't have a sharps container here at home, so I'm going to use the one hand and recap this needle. And then it shouldn't bleed at all. So now I'm going to go out and record in the patient's MAR the medication, the dose, and the site of administration.